terror. It is a word that has become a new part of the American vocabulary since September 11th, 2001. Fear of terrorism has spanned the globe and has found a home in the lives of U.S. citizens today. But do we still need to be afraid? More importantly, are we prepared, not just on a national level, but on a local one here as well in Wayne County? As we examine this subject, you can decide where you stand in the face of terror in the 21st century. Hello, I'm Steve Higginbotham, and you're watching Health Watch.
Welcome to a new age of health, a new age of healthcare. The time is now, so don't turn your head. Don't blink, for you might miss it. Become aware, watchful.
Terrorism, I think it could be defined accurately as anything that incites fear.
American 737, turn right heading 300.
When we had 9/11, we found out a lot of things, and a whole new era has taken on the terrorism picture. So what we have is an agency now that's in charge of all of the security agencies for terrorism, that's Homeland Security. They learned through 9/11 that every incident, no matter what the incident is, it's a local incident. It's not a national incident.
We still believe it's a matter of when we know and keep uncovering evidence of Osama bin Laden's group and other international terrorists who are actively seeking to develop biological weapons. So we believe that certainly it is something that is in our future.
Even before 9/11, we were preparing for potential biological or chemical, I'll use the word attack, but incidents is probably more likely the word.
But a biological attack can happen here in one of our restaurants in a salad bar. Case in point, there was a cult out in Oregon. They wanted to affect an election that they were involved in, so they got the bright idea to put a biological agent to make people sick on a salad bar in an area where the voters were likely to vote against what they were proposing.
We tend to think of terrorists as being, quote, Al-Qaeda and the very organized Middle Eastern groups that bring fear to the United States. But terrorism can come to the local level.
A prime example of that's Oklahoma City. Back in the late 90s, Timothy McVeigh was a domestic terrorist, and he killed hundreds of people by exploding a bomb outside of a federal building. I think that what we saw there is that there was an individual who had a dislike for the American government, and he was an American citizen. Columbine High School. I think that if you really examined that situation, that could have been considered an act of terrorism.
Columbine was a domestic terrorist attack. These were a group of young men who had an idea that they wanted to inflict terror on their high school kids. I don't know that they had planned it to go to the extent that it did, but that's a perfect example of a domestic terrorist attack.
In Indiana, there are all of these cities, and all of these cities have federal reservations. They have post offices. They have federal courthouses and other federal office buildings that could be targets. But we also have the means for commerce. You know, we have multiple interstates that run through our state. We have areas such as the Wayne County is contiguous to Ohio and close to a large metropolitan area in Ohio, and would serve as the surge. You know, people would surge across state lines into Wayne County if that were the case, and we have areas like that throughout the state of Indiana.
We would absolutely be amazed if we knew of the actual number of hazardous substances that actually were transported through our community as part of the interstate commerce system.
From an accidental chemical release standpoint, that is a major concern. We've got two, actually. The railroad, which passes through here and moves very large quantities of hazardous materials. They're rated at 10,000 carloads per year on the line that passes through Wayne County. And of course, Interstate 70, which handles up to 300 trucks per hour in commercial traffic. About 10% of those carry hazardous materials.
But we're such a mobile society, we're so transient that we move from one place to the other. So any piece of equipment, any piece of mail, any person has the ability to travel hundreds of miles in a day.
And commerce, not Al-Qaeda, but commerce is more likely to bring a biological or a chemical incident into our state, whether it's an envelope that's contaminated with anthrax spores coming in to a postal or through a postal facility just by happenstance, or whether it's a truck carrying some biological or chemical agent.
We believe, first of all, Al-Qaeda and its network has been reduced in effectiveness. It may not have the capability to plan and carry out large attacks like we saw with September 11th. What it certainly is capable of doing, however, is focusing smaller attacks in actually larger areas, looking at schools, for example.
Right now we're thinking big cities, New York City, California. We're immune to that in Wayne County. But if you really want to cripple, and my feelings are cripple a nation, hit them in the small spots.
The intelligence stream seems to say that our most vulnerable place and the place that would hit the heart of America would be in middle America and probably a school, preferably an elementary school.
If I were a terrorist and we really wanted to send a message that we can hit you and hurt you wherever we want, attacking a school in the Midwest makes a lot of sense. That would strike fear and panic into every corner of the world.
And that's probably one of my greatest fears, and that's why I take this so seriously, because I think that is a reality, and I think we have to be ever vigilant.
I think that we're all on their radar screen, but I also think that we have the intelligence gathering capabilities to monitor those situations very closely.
But it's a possibility. We had weaponized anthrax, and smallpox is one of those things that would bring us to our knees as a nation. If we had an event in Anchorage, Alaska, or in San Francisco, California, or in the smallest burg in the state of Florida, Indiana would be standing up as if we had the incident in Indianapolis, Indiana.
Every one of these agents have an incubation period. And the incubation period is it's like anything else that you get. If you get the measles, there are chicken pox as an example, would be a good example. You get exposed to it and you don't know that you have it. You actually have it, but it has to incubate in your system. So these are anywhere from 2 or 3 hours to 4 or 5 days, depending on your body system and depending on what the agent is.
First of all, in order to use an agent like that, you have to be able to have the knowledge and the skill to handle it, because if you don't handle it properly, then you yourself are going to be the first victim, whether it be anthrax, smallpox, what have you.
Large-scale panic type things probably would be very difficult to do. Like the sarin gas over in Japan on the subway, they had enough quantity of that to cause bigger problems than they did, but they didn't know how to disseminate. They couldn't get it out into the air. So yes, it is a threat, but there's a lot of variables.
You have to look at the ability of, number one, the individual being able to come up with the agent, handle the agent in a safe manner to protect themselves, and then more critically is the ability to disseminate that to do harm to large numbers of population. And there's different elements, different phases and facets of this whole process that it's just not that easy to do in the big scheme of things.
Let me give you an example of what it would take to kill somebody. If you take a penny, you turn it over where you see the Lincoln Memorial. Now, my eyes aren't good enough, but if you can look in the middle of the Lincoln Memorial, you see Abraham Lincoln's head. You take a source of a lot of these different agents, just take one of these agents and put it on the head of Abraham Lincoln in the penny, that's enough agent to kill you.
Terrorism incites fear, so I think that you would see a significant decrease in the number of people that would actually frequent our local malls and local shopping areas for fear that somebody might be tempted to attack.
That is a good example. We have another good example right now with the gas prices as a result of Hurricane Katrina and Rita. There would be economic impact. One of the other things to factor in, if we would happen to be in an area where the outbreak is occurring, how willing are people going to be to deliver supplies of gasoline and food and medicines to us? We can see both ends of that spectrum being played out.
If there was an incident in San Francisco, California, or in New York City where somebody, is thought to have been exposed to a particularly communicable disease that might be humankind incepted, we're going to stand up across the nation.
Certainly, from an economic, a monetary standpoint, we saw the effects that 9/11 had on the airline industry on Wall Street. Stocks fell dramatically. It took a very long time to recover, to get the stock market back up to where we felt it was healthy. There could be some tremendous impacts, and there could be some impacts we can't foresee.
There are a lot of things that could affect us in ways that are unrelated to an incident that occurs in Indiana that's even biological or chemical in nature. Commerce and industry could be affected by an event. Look what happened to the meat industry with mad cow in Canada and in Europe, where an entire industry can be brought to its knees for whatever period of time because of a single event or the threat of an event.
Terrorism is a broad word with many definitions. What constitutes an act of terrorism? Where does terrorism come from? More importantly, what are we doing as a nation and on a more local level as a county to prepare for a terrorist attack? The issues of domestic and international terrorism bring up numerous and perplexing questions. But one of the many things that we have learned as a nation from both 9/11 and Hurricane Katrina is that communication is essential to deal with national tragedies. How do local and national agencies communicate with each other to not only prepare for a national or local emergency, but to respond to one as well? And what is our role as individuals and families to prepare for the unimaginable, another terrorist attack or public health emergency of epic proportions?
The 9/11 incident became a bigger incident than it needed to be, and it was a catastrophe anyway, but became more of a catastrophe because of the lack of communication between agencies, for the lack of really knowing what to do. A lot more people probably died because of that.
Hopefully, if there's one positive effect of Hurricane Katrina, it has shown that the response system does have some limitations, and that we need to get back to some basics of being able to care for ourselves and our families for a period of time without government assistance.
So there's been a lot of infrastructure building, a lot of capacity building. Do you have the plan? Where are you going to get your volunteers? Where are you going to stand up your clinics? Who are you going to work with to get in the resources that you need to get in?
My job now is to finalize that plan, and my plan will have to include to be able to vaccinate, give a shot, or pills to 72,000 people in Wayne County, and our target time is 48 hours.
It's easier said, unfortunately, than it is done, because we tend to, and I'm not slamming ourselves or anybody when I say this, it's how we work effectively. We tend to work in silos. Public health works in the public health silo, hospitals work in the hospital silo, public safety and the military and so on. Everybody has their own silo. And everybody, in a mass casualty event, you know, the silos are kind of forced open and people who aren't used to working with one another work with one another, but it's somewhat disorganized chaos depending on the event.
We work in 4 primary areas. When a topic, whatever that might be, bioterrorism, is brought up, we go through a planning process. We get the agencies that will be involved in that issue together. We lay out the problem. We see how we're going to respond to it. We commit that to paper. We then work through a training scenario where the plan information is put out so that the agencies have the opportunity to understand it, to train with it, to make sure their people understand the issues that are involved and what's going to be required of them.
No agency in itself could deal with any type of an event of that magnitude. Therefore, we have to work together. And what we have done is we've had an emergency management plan that has been in place since the 1980s. And since then, Fred Griffin, our emergency management director, does an outstanding job of making sure that our plan is up to date, that we're aware of what's going on.
My job is to learn, go to these classes, read and learn, and make personal relationships. I have got to have personal relationships with all of these first responders.
The communication system throughout the Gulf area were decimated. That included not only cell phones that people depend on, but also the communications infrastructure that local governments depend upon. When towers go down, and your communications goes with them. And that was a big effect.
One of the things that we realize that we have a weakness in is communications. And we're working with state officials and on the local level, we have to make sure that we have interoperable communications that allow us to communicate not only with our partners here locally, but partners from other areas.
We are looking at that now very hard. We do have a variety of communication systems that are used. We have backups to those communication systems. We employ our amateur radio community to assist us with a lot of those backup communications. But we're also looking at things like, do we need satellite phones? It's going to take a pretty big hurricane to suck a satellite out of the sky. So as long as satellites remain operational, that gives us another backup. Because if we can't communicate to the outside world what our needs are, the outside world can't really help us.
Communicating as governments, communicating what we can do to be diligent, to mitigate, and what we're prepared to do to respond and recover from an event is going to be important, because it's going to alleviate some of the fear that you and I have as citizens, and won't make us dysfunctional in the way that we interact with one another and go out and do things.
And it's so good to see that the sheriff, that the fire department, that the police department, that city government and county government actually communicate with each other and work together and want the best for our citizens. This is not the case in a lot of counties.
Fred Griffin, our emergency management director, does an outstanding job of making sure that our plan is up to date, that we're aware of what's going on. We train together.
We're small, but we're mighty. We have worked in areas not only of general emergency planning for all types of disasters that may occur and infect Wayne County. We also specifically focus on hazardous materials and terrorism to make sure plans and procedures are in place to address those kind of issues when they do arise. We have an active exercise program where those topics are exercised on a regular basis, so our folks that are going to be responding to them aren't going into it cold.
I think in today's society, anything is possible. I really believe that. I just believe it is. We're living in a world today that's so far different than the world that I grew up in. My children, and particularly my grandchildren, are going to live in a different world than I ever imagined. So I think anything is possible. But I think for us to live our life thinking that these things are going to happen to us is not something that our Creator intended us to do. I think that we have to be more aware now. I think, and this is positive, we have to be aware of our surroundings.
The thing we have to remember with Israel is that they have literally become experts at dealing with terror attacks. And they've had 4 decades of experience. I mean, we're looking at, they've been dealing with this since the late 1960s and maybe even before that. So they've had an opportunity to really learn about and to develop plans for these types of events. The one thing that they do very well is they educate the public. They actually begin the education process of making young people aware of their surroundings and what to look for. There are certain characteristics that a homicide bomber will have, for example, so that they can make the appropriate authorities aware of the fact that they may have a problem with an individual who could be attempting an attack.
Looking at the Israeli experience, you have to understand they have been in this situation for a very long time, and they have had to adjust their culture to meet that need. Over there, it's my understanding, you don't go hardly anywhere without there being armed security present. Can you imagine going to your friendly neighborhood restaurant and there being armed security that you would have to pass through on every visit? That is a big shift in culture from what we are used to as Americans.
The Israeli people have made security a way of life.
It works for them. In our culture, I'm not sure how that would be accepted. However, if the war on terrorism continues for as long as it might continue, we may see those shifts in culture here. It may be a necessity. It's going to be a balance between what we're willing to sacrifice in our personal liberties for our safety.
Preparedness, I think, is actually it's a community effort.
We're not just talking about terrorists, we're talking about just the plain society has changed so much. So the one good thing to come out of this is people are more aware today, but they don't have their head in the sand like they used to. But on the same token, we don't have to walk around in fear. We have a lot of safeguards in place. Our government has done a wonderful job, particularly with Homeland Security and the law enforcement agencies, to make us a safe country, and we are a safe country. We just have to be more aware.
As far as what we need to do as citizens to prepare, everybody needs to have a family plan on how they're going to respond to emergencies. How you prepare for terrorism really isn't any different on how you prepare for a tornado, an ice storm, or an earthquake. We need to have some basic things in place. We need to have some basic communications in place. How am I going to get in touch with my family when my family is dispersed to school and work and communications are down? We recommend that they have an out-of-state or out-of-area contact, certainly somebody who is out of this area code that they can call, and that can be kind of a point of contact for all the members of the family, just to let them know they're all right where they're at and what they're doing to or what their needs are. They need to have some basic supplies, some things that will allow them to have some shelter if shelter is needed, to eat, to have water, to have some information and some light, the critical things that we need to take care of ourselves for a period of 3 days or so. We do have information on our website that is available on home preparedness. Encourage folks to take a look at that. If they don't have access to the web, we certainly have copies in our office, and just give us a call. We'll be happy to send them one.
That's also a culturing issue for us too. Firefighters are used to exercising. Military is used to exercising. Public health isn't used to exercising. Hospitals, some things that they do, and none of those are criticisms. It's just that that's the thing that we need to be really focused on now is working with one another, exercising, and doing real exercises. Not planning for a perfect exercise that's going to get an A+, but exercising a room that doesn't have internet capability right now. And everybody kind of thinks it does. And so you go and you plug in your computers and you see what happens when you don't have the capability to communicate that you thought you had, just as an example.
I think, number one, we'll never be where we need to be. I think it's impossible to do that, because you can have all of these plans, but unless you exercise them and then use them in real life situations, that's what the time you perfect them, and you can always improve. It's like an athletic contest. You know, you win a game, you have another game to play. You have to take the things you learned in this game to transpose that over into that next game to make you play better, so you have a chance to win the next game. That's what we are. We're in a game here.
So identifying and coming up with contingency plans for how you're going to deal with a particular event, and working with partners that you're not used to working with, whether it's the FBI and the Public Health Agency working together to identify the potential source of a biological problem, or emergency management working with hospitals or whoever it might be, people that don't normally work with one another, having them work with one another in exercises and in responding to real events, and coordinating how you're going to clean up the holes and fix the deficiencies, and not worrying about whether you got the A+ or the C+ or the F. But you know, it's moving forward. That's what we're going to be doing.
We have a great life in this country. We have, you know, our government system's not perfect, but it is very good. I think that, you know, although everyone doesn't agree with decisions that government officials make with regard to homeland security or national security or local preparedness, there are things that we need to ensure their safety. Unfortunately, public safety is a very, very expensive business. It's a service that we, as citizens of not only Wayne County, but as citizens of the United States, I think we demand it. And I think government has an obligation to protect its citizens, and I think that we need to keep that in the front of our minds when we look at what it costs to make sure that the people that are providing that service are also safe.
We are always going to be a target for somebody's hatred, whether it's our policies, whether it's our finances. It's a matter of haves and have-nots, and we want what you have. Seems to be the basic premise. How do you make that go away?
And I'm not sure anybody is ever 100% prepared, but each day we're going to be more prepared, and we're going to have people in place to handle things. So it's an ongoing process.
Like I said before, this is a problem that is not going to go away. The federal government's emphasis may change, but the threat is going to remain, and we still need to be prepared for it.
Somebody just asked me, are we prepared to take care of a major biological attack in Wayne County today? No, we're not, but we're going to be better tomorrow.
Terror. The word has embedded itself into the accounts of history throughout the ages. As our nation enters one of the many pages in the historical account of terrorism, we have questions that we must ask ourselves. What have we learned since September 11th, 2001? And will America supersede a level of fear from the threat of a biological attack unseen since the days of the Cold War? And what can we do to prepare and protect ourselves from the unthinkable public health disaster? The questions are there. The answers are continually being found. Thank you for watching Health Watch. I'm Steve Higginbotham saying good day and good health.